The lead pipe case, in historical and psychological literature, most commonly refers to Phineas Gage, a 25-year-old railroad foreman whose infamous brain injury in 1848 revolutionized early understandings of the brain's role in personality and behavior. On September 13, 1848, while working on the Rutland and Burlington Railroad in Cavendish, Vermont, Gage was using a tamping iron, a large, pointed metal rod, often misremembered as a lead pipe in some retellings, though it was iron, to pack explosive powder into a rock to blast it apart. The powder detonated prematurely, propelling the 3-foot, 7-inch, 13-pound rod through his skull at high speed. It entered below his left cheekbone, passed through his frontal lobes, and exited the top of his head, landing about 80 feet away, covered in blood and brain matter. Astonishingly, Gage remained conscious, walked with assistance to a cart, and was treated by Dr. John Martin Harlow, who cleaned the wound and removed fragments. Against all odds, he survived, regaining physical strength within 2 months, though he endured infections and seizures initially. Gage's pre-injury personality was described as efficient, well-mannered, and reliable, traits that made him a respected leader among his crew. Post-accident, however, dramatic changes emerged. He became fitful, irreverent, profane, and impulsive, exhibiting little deference to others and struggling with planning. Harlow later noted that Gage was no longer Gage, likening him to a child in emotional control. These shifts, confined largely to the frontal lobes, destroyed tissue estimated at 11% of white matter and 4% of cortex via modern reconstructions, provided the first compelling evidence that specific brain regions govern social inhibition, decision-making, and executive function. Though exaggerated in some 19th-century accounts, e.g., claims of him exhibiting his skull for pay, Gage worked odd jobs afterward, including as a stagecoach driver in Chile, before a seizure in 1860 led to his death at age 36 from status epilepticus. Gage's case, detailed in Harlow's 1868 report, became a cornerstone of neurology, influencing figures like Sigmund Freud and modern localization theories. His skull and tamping iron are preserved at Harvard's Warren Anatomical Museum, symbolizing how a lead pipe, or iron, mishap unveiled the brain's fragility and complexity.